I just want to point out that I think SANOFI should set aside resources so that people who are sick right now, as there are two people here, and I will call them Ian Colite, the child died. He was not asked if the child had previous dengue. We're told to get vaccine because it is free and expensive in the public market. So this is the kind of thing that I'm talking about, and that's why I was asking you about the capability of PCMC to be able to do this program. Second, and they signed a small paper from the school. Is she here, the Colite parents? Pakitayo lang ho at lumapit lang po kayo rito. While you're coming here, lapit lang ho kayo. Habang lumalapit, SANOFI and DOH should be in discussions on how all these people can be assisted. Because rightly or wrongly, it has created a very challenging situation where every pain will now be attributed to Dengvaxia, rightly or wrongly, because it has created that very, very serious threat in the minds of people. And from the very beginning, this representation, as well as the committee, has been trying to say vaccination per se is not wrong, but in this particular case, we heard it from Dr. Ona, we heard it from Dr. Guerrero previously, we heard it from previous other people here from the scientists, that this was done too peremptorily, too fast, and that the development has not been allowed to go into fruition, and that's why we're having all these problems. Of course, that will be a matter for the courts to decide. In the meantime, I'd like to call Ms. Gemma Evangelista, kayo po ba yan? You have a child, may anak ko kayo may sakit ngayon, no? Nasaan po yung anak niyo ngayon?
Sir, pumapasok po siya ngayon sa school, sir. Kahit po may sakit po siya. Outpatient lang po kami to follow yung mga check-up niya po, sir.
Nagbigay ba kayo ng consent na tuturukan kayo nung sinabi sa inyo?
Sir, yung first and second dose po, mayroon po akong papel na pinirmahan na consent na pumapayag ako na turukan yung anak ko ng Dengvaxia. Pero ito pong last na wala po akong pinirmahan na consent para turukan yung anak ko. Pero naturukan po yung anak ko at the same time, may sakit po siyang beke.
May sakit siya ng beke na tinurukan siya?
Yes, sir.
Mr. Secretary, I think you should really take note of this because this is the second time na talagang we have presented a witness here. The previous one was Rafael. Di ba Rafael? From Batang, na tinurukan while he was sick and he was brought to one hospital, then transferred to another hospital until he expired. And this is what I'm referring to, Mr. Sanofi, Mr. Triumph, that these are cases that are going to come out of the woodwork and we must help them. Not because we have to do so legally alone, but out of humanitarian concern. SANOFI is a company that has done well. Its pastor is a great scientist who produce a lot of vaccines as well. And I think it behooves you to help these patients. You don't have to wait for us. I mean, if I were advising you as a lawyer, I would tell you, help already people who are being hit before the government asks you to do it, because that will show good faith. Kayo po, Ian Colite, namatay yung anak nyo. Pakisabi lang ko kung ano nangyari sa anak niyo.
Yung araw po ng 26, sir.
26 ng Marso?
Last December po. December 26 po. Sumasakit po yung tiyan niya. Meron po siyang
Pero
rashes.
kailan siya tinurukan?
First, una po yung June 21, 2016. Then the second is January 22, 2017. Then the last po is yung June 24, 2017.
At wala akong problema?
Wala pong problema ng mga nakarang buwan. Pero itong December po, doon po sumakit yung tiyan niya. Tapos namamantal yung katawan niya. Nagkakarashes. Tapos nangihina po yung bata. Nangangalat po yung dalawang balita.
May dengue po ba siya?
Wala po sir. Malakas po yung anak ko, sir.
Kasi ang problema dito, sinabi ng SANOFI, pagka kayo ay wala pang dengue at tinurukan kayo, pag nagka-dengue kayo, maaaring severe.
Wala pong dengue yung anak ko, sir.
Wala pang dengue ngayon?
Wala pa po.
Ngayon walang dengue?
Wala po.
Pero nagtataka lang kayo kung ba't nagkakasakit?
Yes, sir. Usually, sir, pumanaw na po siya nung December 27 po.
Pumanaw nga pala, no? I'm sorry. Tapos
po,
po, 1 year, 2 years, 3 years, 4 years, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years, 11 years, 12 years, 13 years, 14 years, 15 years, 16 years, 17 years, 18 years, 19 years, 20 years, 21 years, 22 years, 23 years, 24 years, 25 years, 26 years, 27 years, 28 years, 29 years, 30 years, 31 years, 32 years, 33 years, 34 years, 35 years, 36 years, 37 years, 38 years, 39 years, 40 years, 41 years, 42 years, 43 years, 44 years, 45 years, 46 years, 47 years, 48 years, 49 years, 50 years, 51 years, 52 years, 53 years, 54 years, 55 years, 56 years, 57 years, 58 years, 59 years, 60 years, 61 to be fair, no po, para parehas ho tayo, dapat nalaman sana natin kung may dengue siya nung namatay siya, no? Pero pwede naman nung malaman ng Department of Health kung connected sa dengue yung sakit niya. Ano po yan?
Usually po, nung umuwi po kami ng bahay, yung anak ko po nasa morgue, may tumawag pong doktor, papunta dung Las Piñas doktor, to yung city government ng Imos. Tapos si city government po ng Imos, tumawag po ng sa health center po sa amin, at sinabi po ng gabi na yun is, yung anak ko ay nag-positive sa dengue. Pero ang kinasama ko lang po ng loob, bakit po tinago nila yung resulta ng x-ray ng anak ko, yung dugo, lahat po ng test tinago po, hindi po sa amin binigay.
So, ang sinasabi nyo, pagkatapos mamatay yung anak niyo, nagpunta sa inyo yung Imos at sinabi nagka-dengue siya.
Yes po, yung araw po ng gabi na yun, napag-uwi po namin ng bahay. Kaya po naalarma po kami.
Nasa morgue pa yung anak niyo nun? Nasa morgue pa?
Yes po. Ang nakalagay po kasi ma'am, ay sir, sa death certificate is CIPS2, acute appendicitis. Pero meron pong nauna sa amin dun sir na 2 linggo na po na appendix yung anak niya, pumutok na po, bakit hindi po namamatay? Tsaka oras lang po ang binilang ng anak ko. Biglaan po, nagwa-wild po siya sa ospital. Hindi po siya nakakilala ng tao.
Ang mahalaga sa sinasabi niyo, sinabi ng Imus na ang kanilang resulta ng test ay nagkaroon ng dengue.
Tumawag po yung doktor sir ng Las Piñas.
Ito po si Secretary of Health at sinasabi ko po sa kanya para maharap ka agad dyan and to conduct the necessary examination. I would also request the Secretary of Health to take control of the situation because a lot of people are coming out of the woodwork conducting examinations and saying this is dengue related. We have to have the proper scientists determine whether in fact it is not born out of hysteria but born of scientific findings that the patient really had dengue so that we could get to the bottom of this. This is not a take revenge on Sanofi time. It is trying to find out what the facts are, show our integrity as a nation, and if they are indeed guilty, then we should go after them. Is that fair?
Yes, Your Honor. I do support the chairman's position on the matter.
Can you ask Dengue now, write the letter and say, mag-set aside na kayo ng resources, di naman kailangan malaki kaagad yan, para any kind of diseases that will come out of this will be, they will be assisted not just by PhilHealth, not just by government resources, but by them. Or if that results, they should also help.
Your Honor, we already have the draft letter addressed to Sanofi for asking them 2 things, essentially. One, sir, is for them to refund the amount of used vaccine. And then number 2, to set up precisely what you have been explaining, an indemnification fund from where we can get the funding support for all the patients and for future.
Right now, the government is carrying the load, right?
Yes, we are. PhilHealth and through the medical assistance
program. And I'm just saying, Sanofi should help carry the load right away.
Yes, Your Honor. It would be best to
complement. And that's why the concern of Senator HONTIVEROS and our concern, we all are in convergence insofar as this concern is to prevent, not just the disease or not just but the mental anguish of many patients. In fact, I don't mind telling you that the Red Cross is also mobilizing our chapters to find out, to help you in case you need help.
Thank you very much.
Find out who are the people who were given shots so that we can find out whether they had dengue before or not. That's a very big undertaking. And if that happens, Sanofi ought to help out.
First of all, let me say that as a father of 3 children, I completely sympathize with any suffering. I have children from teenager age and younger. As a father, I've seen a lot of the media reporting recently shown with allegations and photo montages, and these are sickening to me. Secondly, as an employee of Sanofi Pasteur, I want to make clear that this is exactly because infectious diseases are terrible, devastating. This is exactly because vaccines are the best way to actually fight infectious disease. And the more than 10,000 employees of Sanofi Pasteur are working very hard and are committed very hard to develop, provide new vaccines, innovative vaccines, to make sure that we can fight against infectious disease.
Thomas, can you please answer the question? We know that Sanofi is a great corporation. I'm willing to accept that. But also, even if it's a great corporation, when it is liable, it must accept liability. And you've done that in the past, haven't you? So when your people have been corrupt in other places, you have paid. When Dengvaxia did not work in France, your own government covered you. So the question is very simple. Would SANOFI be willing, and I know you are at the low end of the totem pole here, it will have to go through your CEO, but I think I feel that the senator just wants to ask some direction, and I personally want to see whether that good faith or that direction is something that you're thinking of already.
I'm trying to get to the answer, Your Honor.
Well, do it a little faster.
I'm trying.
No, because you're selling. You're still selling. You're still selling that the drug is efficacy. You're still saying that the company is a very good company. We have already bought. But I don't want you to sell me on that because what you did is something that has caused a lot of pain here in this country. Although I'm not judging you yet, but in case the jury comes out that in fact, and as you said on November, that your research shows you that what you presented, oops, sorry, don't give it to zero negative. It's already out. The horse is already out of the barn. You know what I mean? So on that note, we want to have some direction from you. That's not a very unfair question. That's a very fair question. You want to know what kind of identity you have, what kind of character your company has.
Our company is holding itself to the highest standards of compliance and of ethics.
Good. Is your company are you going to recommend your company that at least to assuage the many people who are in pain right now that you take care of it? Because maybe for all you know, it may not cause that much pain. Maybe in the end, you'll be proven right. But at least in good faith, because you came out on November to change your basic recommendation, rather than have a big law case right now. I'm a lawyer, and I think a big case can be filed again, and you know that. I'm sure your people know that. The very fact that you right away got back the balance and repaid us for the balance is an indication of that. So all we want to know is something that you can say to us to assist people like these people who are in pain.
I'm coming to it, Your Honor. So as for the later point, so regarding the reimbursement of unused doses that you just mentioned, Your Honor, as you remind from the previous hearing, Sanofi was waiting for the decision of the DOH to know if after the decision of suspension of the public program will be restarting or suspended. It is de facto our understanding from the Department of Health that the program was stopped. As a consequence, we have decided, without any contractual obligation, to recall and reimburse all the doses that were unused. Fourth point, as mentioned before, of course, we are a corporate social company. We have high ethics, and obviously, should there be any case related to vaccination, be it death or any other case, we will shoulder the cost if there is a causality that has been demonstrated through scientific evidence.
Yung sa health center po namin na dalawang representative po ng health center, sila po mismo ang nagsabi sa amin na may dengue po yung anak ko. Kasi may tumawag daw pong doktor galing po sa Las Piñas Hospital to Imus. Then si Imus naman po nakapag-coordinate sa health center po namin. Kaya po nagulat pa lang po kami nung sinabihan kami na positive yung anak ko sa dengue. Tsaka dagdag ko lang din po, hindi lang po private school yung binakunahan. Meron din pong private sa barangay, sa private hospital. Tulad po ng amo ko, yung anak niya po naturukan po sa malaking hospital sa Makati. Yung GM ko rin po naturukan yung anak yung dalawang kambal sa barangay din po.
Salamat po, Ginoong Colite. At least input pa yon dagdag sa DOH database at sa pagsubaybay nila sa investigasyon ng iba't ibang mga lupon. So, Secretary Duque, tama po ba na you are still, the department is still calling on PAO to conduct autopsies on children who died of dengue but were not given Dengvaxia, and then to compare the results?
Mr. Chair, actually po ang sinabi kasi namin, tinanong nila kung hindi pa conclusive yung mga autopsy dahil very strong naman daw yung parang yung nakikita nilang evidence. So ang sabi ko po ay Strong yon kasi ang nakikita natin na merong silang ebidensya pero ang nakita natin 7 bata lang na naturukan ng Dengvaxia. Hindi naman natin alam kung may pagkakaiba yon sa hindi naturukan ng Dengvaxia na matay ng dengue. Kaya kailangan aside from the forensic na ginagawang study ng PAW ay isama yung clinical study na ginagawa ng PGH para maging mas maganda yung ating appreciation ng ating fact.
I want the Department of Health to get back its position as the premier advisor of the country on health matters. You are the director. You are the ones in control. And of course, if the science is used, you are not going to make as many mistakes as has happened here. And that is really something that I say here because we want our old Department of Health back. All right? The one that protects the people. Gusto namin mabalik yan. Okay? Yes, ma'am. Yama, Evangelista.
Sir, gusto ko lang pong ano sa DOH ngayon, yung case ng anak ko. Kasi nagkwento si sir, dito lang po kami nagkita sa araw na to. Kung ano yung naramdaman niya sa naranasan ng anak niya, ganun na po yung nararanasan ko ngayon.
Buhay pa yung anak niyo?
Opo, hinihimatay na po siya. 3 times na po siyang hinihimatay.
Ilan taon po yung anak niyo?
11 po, sir.
11,
Yung first na atake niya is nung December sa tapat ng bahay namin. Totally bumagsak talaga siya. Tapos nitong twice na itong January. Nitong Thursday, Wednesday lang, akala ko tulog lang siya. Kasi pagdating ko tulog siya. Ginigising ko siya, tinitingnan ko siya, sabi ko dun sa kuya niya, Nak, bakit ang tagal gumising ni ate? 5 na ng hapon. Tapos, sabi niya, Mama, pagdating ko tulog na talaga si ate, sabi niya. Sabi ko, Nak, ginigising ko siya. Nak, hindi siya gumagalaw. Sabi ko, bakit parang iba yung di pinulsohan ko po siya, sir. Tapos, yung puso niya parang papatlang-patlang yung niya. Ginawa ko, pinampo yung dibdib niya. Tsaka siya, Mama, sabi niya gano'n. Sabi ko, Nak, mamamatay ka na ba? Kasi bakit ganyan, hindi na kita... Kung ginigising kita, usually bumabangon ka kagad. Bakit gano'n? Kasi mama, pagdating ko, masakit na yung ulo ko. Sabi niya gano'n. Tapos itinulog ko na lang kasi wala pa si kuya. Sabi niya gano'n. Kaya natatakot ako kasi yung nararamdaman ng anak niya, gano'n na po yung nararamdaman ng anak ko ngayon, sir.
So the Secretary of Health, please send a special unit there right away.
We will do that, Your Honor.
This afternoon or even now, call somebody to see that patient. Saan ho yung anak niyo?
Saan ho yung pasyente ninyo? Sorry.
Sir, pumapasok pa po siya ng school ngayon kasi dapat po last week.
Address na lang po.
Pasig City po kami nakatira, sir. 544 Duat Street, Pasig City po.
Para ma-check. So ambulatory, lumalakad, pero may
kasi dapat po magpapa-check up kami kasi gusto ko na nga siyang ipa-check up nung kaso ayaw niya dahil mama, examination week namin. Ayaw kong umabsent kasi nung first grading ang bababa na ng grade na binigay ng mga teacher ko, walang konsiderasyon na ibinigay sa akin dahil alam nila na on and off na kami pumapasok. Tapos ayaw niya na pong umabsent dahil nga mababa na daw po yung grade niya.
Kilala ko ito si Secretary of Health. Gagalaw ko yan.
Natatakot lang po ako kasi baka yung case ng anak niya mangyari po sa anak ko.
Sige po. You can call us po kung wala nangyari. Ano po?
Mr. Chairman?
Yes.
Baka po the committee could also make a special request to DOH na yung anak nila and other parents rather who have come forward to the Blue Ribbon ay parang, I don't know what you call it, a special bulletin sa database sa pag-monitor, Chair JV, na maagapan kaagad proactively on the part of the department.
I'd like to see that program happen.
Yes,
that all the people that have been given injections or for the vaccine, alam na natin. And then, again, we have chapters all over the country. And if they're in a school, they can come so that we can check, and then we can refer them to DOH.